For many years, there have been suggestions that psoriasis is linked to many diseases, and there is growing evidence in support of this, and the International Psoriasis Council recently held a collaborative consensus meeting with medical professions from across different areas to assess the growing evidence linking psoriasis to other diseases, and you have been meeting especially on this. Could you make us a brief about it?
Certainly, the International Psoriasis Council was formed 2 years ago. It comprises leaders in psoriasis worldwide, and its main goal is to disseminate knowledge of psoriasis to their fellow professionals, to enhance the understanding of psoriasis as a serious immune-mediated disease. As part thereof, we have different conferences, and the conference that we held yesterday related to diseases that may coexist with psoriasis that we feel are important enough for further study.
What made IPC focus on comorbidities in psoriasis?
There's been increasing evidence over the past few years that psoriasis is not merely a skin disease, but is associated with significant diseases. We've known for a long time that some patients develop psoriatic joint disease. There are links with gastrointestinal disease as well, and more recently, suggestions that patients with psoriasis are heavier in a weight perspective than non-psoriasis patients. And of course, with obesity and increased weight comes other comorbidities that we need to understand, such as hypertension, potential heart disease. These are things that we are going to investigate, and as we go forward, see whether there are truly links between psoriasis and these other diseases.
And how do doctors feel about treating psoriasis today? Do you think something has changed?
I think there's been an increased awareness of the severity of psoriasis, not just physically but emotionally, and the need for us as physicians, and hence the International Psoriasis Council's role to disseminate knowledge that we need to take psoriasis more seriously and treat it more aggressively, particularly for people who have more than just a few patches of psoriasis.
Do you think treating psoriasis at the first stages could change this? Do you have evidence in that?
Whether the current biological therapies that are out there are truly what we call disease modifying. In other words, if we start treating earlier with some of these new systemic medicines, will it change the natural course of the disease, are things that we hope to study in the years ahead. But we certainly believe there's a hope that that may happen.
Does World Psoriasis Day have a part to play in supporting research in psoriasis?
I think one of the roles of International Psoriasis Council is to disseminate knowledge to fellow professionals and to link with patient organizations so that they can take the message to the patient groups that are out there. And as such, World Psoriasis Day plays an important role. And we're hoping that the messages from our meeting that eventually will be publicized and published in peer-reviewed medical journals will enable patient communities to take the understanding of this back to their physicians as well.
Do you think this would also make a difference in the health authorities working together, patients and doctors?
We sincerely hope that the combination of patient organizations and the International Psoriasis Organization will allow us to take the message to healthcare providers for them to also understand the seriousness of the disease.
Should people with psoriasis be worried?
I don't think there's reason for concern. I think people need to be healthy, both physically and mentally, and I think once we come up with some answers relating to these potential diseases that are associated with being overweight, we would advise patients to, obviously live as healthy as they possibly can. And hopefully by improving their psoriasis state, that'll give them the impetus to improve their general health as well.
And how can people with psoriasis contribute to raise the awareness of the links between psoriasis and other concerns?
I think what patients with psoriasis need to know that there are the potential other diseases that psoriasis patients may have, to make sure that that message gets out to their regular primary care or general physician, so that the healthcare professionals outside of dermatology also become aware of the need to evaluate psoriasis in addition to the skin for all other diseases as well.
What would you advise a patient with psoriasis? It's not an easy patient, isn't it?
Patients with psoriasis need to be educated about their disease. Just like patients with diabetes and patients with arthritis are educated about their disease, they need to take this disease, understand it better, and if their physician is not providing them with the correct therapy, help educate their physician or find a physician who understands the disease better.
Thank you very much, Dr. Mint.
Okay, thank you.
Are the links between psoriasis and other health concerns widely known amongst general medical practitioners?
I don't think so. I guess, and I know this from experience, that general practitioners have a knowledge about psoriasis, but they are not aware of comorbidities that may occur in some of the patients, and possibly they don't also check for that.
How do these findings impact in clinical practice?
This is obviously not a thing which has been fully worked out.
Mhm.
We are in the moment in a situation where we collect data, where we see that some part of the patients have additional health problems, others don't, and we now need to generate more data in order to identify populations at risk. And so it's possibly too early for general recommendation, but what we can say is that one should look in patients with psoriasis in the clinical examination for associated diseases.
Will this lead to a larger increase in diagnosis of comorbidities or changes in the treatments, would you say?
Possibly in the end, for both questions, yes. I think that if you look for comorbidities, you will, of course, see some early developments, some minor cases as well, which would have been unrecognized as well. And since all the comorbidities as well as psoriasis go back to a common pathogenetic event, there will be, of course, strategies that aim to control both.
You have been today in a very important meeting and yesterday, and what would you say are the key messages of that meeting?
The key messages of our meeting, as far as we can say now, that there is emerging evidence which seems to be quite reliable, that a proportion of patients with psoriasis have other comorbidities that bring some risk to them and that need to be monitored. And we aimed to investigate the relationship in the pathophysiology between psoriasis and the comorbidities. That's one issue we aim at, and the second is to integrate our treatment in a way that we have a treatment as broad as possible to cover all the ongoing pathogenic events.
How can IFPA and World Psoriasis Day raise awareness among practitioners about these findings?
I think at World Psoriasis Day these new findings could be transmitted, and since World Psoriasis Day is gains a high degree of attendance by all media, I think that this is a way to transport these information first to the medical community prior to possible publications, and alert the medical community to these associated diseases.
What would you advise a doctor that treated psoriasis?
Actually, I would advise him to check for the skin, which people do obviously, but also to investigate the patient for comorbidities, which we can define, which we know, and we know the spectrum of these diseases, and they are easily investigated, so that a patient seen by a doctor should be checked not only for his skin but also for possible comorbidities.
And what would you advise to a psoriasis patient?
I would advise to a psoriasis patient two things. First is that he asks his doctor to check for possible comorbidities, and second, if these are diagnosed, that he should consider to change the risk factors which he possibly can influence by himself, so that the diagnosis of the comorbidities is the beginning of the treatment of the comorbidities and takes the risk away from the patient in the end.
What are the diseases is psoriasis linked to?
The comorbidities that are associated with psoriasis, as far as we know by now, are several complexes. One is obesity.
Yeah.
This is associated with insulin resistance and sometimes with diabetes mellitus, and also fat deposits in the liver. We now know that the fat deposits produce inflammation in the body, and this inflammation makes the blood vessels sensitive to inflammation and to the formation of arteriosclerosis, including cardiac arteriosclerosis and heart attacks. So this is one point of comorbidities. The second is that patients, of course, suffer from their skin disease much more than has been previously anticipated. So some of them are depressive. There is a tendency for abuse of alcohol and tobacco, which may also be a reflection of the disease burden. And finally, 1/3 of the patients have inflammation of their joints, and some have inflammation of the bowel. So this is the spectrum of diseases we currently regard as comorbidities.
How can a patient take care of himself and those risk factors,
Patient,
apart from going to the doctor?
yeah, the patient with psoriasis has a very severe disease that changes his life completely. And so giving advice is not so easy because he has a severe burden to carry on. But he can listen to his doctor, and he can identify possible risk factors in his behavior. And we believe that many of the comorbidities can be changed in their clinical course if the behavior can be changed, of eating, of drinking, of smoking. And he should consider how this could be possible with his doctor.
Thank you very much.
My pleasure.
Our members have told us about other significant health implications coming from psoriasis, like diabetes, like depression, like heart diseases, and so forth. And those of us who are active in the National Psoriasis Association have been able to see it ourselves in communication with our members, that we have an overrepresentation of people with all these diseases. The International Psoriasis Council's meeting here have confirmed that the psoriasis is just top of the iceberg, and it's a lot of other related diseases. So psoriasis is a very serious disease, and it's good treatment for psoriasis means better life for many people, and it's also good for the economy of all. And now we are asking the politicians around the globe, in all the member states, to recognize psoriasis as a public health issue, because it has very wide implications. Good treatment to psoriasis patients is good for the society and very good for our members. Thank you.
Durante muchos años la gente con psoriasis ha estado diciéndole a la sociedad, a los médicos, que había algo más, además de la psoriasis, que era como la punta de un iceberg, que había otras enfermedades relacionadas con la psoriasis. Hoy, después de la reunión del Consejo Internacional de Psoriasis, se ha dicho, se le está diciendo, se le está llamando la atención al mundo, a los médicos, a los pacientes, a los servicios de salud, que realmente hay comorbilidades muy importantes, la diabetes, la hipertensión, la depresión, muchas de ellas que tienen que ver con nuestra enfermedad. Así que esta información del Consejo Internacional de Psoriasis ha sido algo sumamente importante para confirmar todos estos datos que de alguna manera estábamos escuchando por parte de la gente. Basados en estos datos, ¿qué es lo que estamos pidiendo a los enfermos de psoriasis? A todas las autoridades de salud del mundo que por favor consideren esta enfermedad con la seriedad que tiene y el impacto en calidad de vida que tiene para las personas.